Public Health at Ben-Gurion University. As always, thanks for being with us here. I want to start with these numbers. Over 8,000 new infections yesterday. It's somewhat baffling with such high vaccination rates in the country. Do we know where all these infections are occurring and where are the danger spots?
So actually, this is not surprise because we have the famous R coefficient. The infectivity rate is very high. The Delta variant, without any intervention, the R coefficient is 7. Now it's about 1.3. So we see that there are lots of effect by vaccinations and, of course, using masks, etc. But we need to, of course, intensify those. Now we see all over the country red settlements, cities. So it's prevalent in many places. There's widespread transmission. The third dose, I, by the way, received mine just 2 days ago. I feel great. The third dose is mainly about reducing hospitalization and severe cases. So we will continue to see the spread with the Delta variant. The question is mainly about the burden on the healthcare system and how we can continue and live with the variant without entering into lockdown. And here vaccination is not enough. We need to have, of course, the individual behavior, masks, and also preparations for the school opening with a massive campaign of serological tests, and also preparing for the program on protecting education, Magen Chinuch in Hebrew, and this is about pooling and PCR tests. All of this together as a multi-layer approach should give us the option not to get into a lockdown. The Green Pass, of course, is also important, and I see now a sense of emergency that was not there until 2 weeks ago, and I think this is good, and we need to work all together.
So it's good to hear you think we're moving in the right direction, at least in terms of containing this now. But on the need for a third booster, other countries around the world catching on to this now based on the data. Likely to be a part of our vaccine routine each year, like flu shots?
This is quite early to determine, but this is probably the way we're going to deal with it. We're going to continue and first of all, vaccinate the first dose and second dose, not just in Israel, globally, until we are not going to see high vaccination rates. We're going, unfortunately, to have more variants. And when you have more variants, this is changing the balance, as we saw both with the Alpha variant in the third wave and now with the Delta variants. Vaccinations are going to be one of the most important tools, and they're going to be adapted. But again, this is not enough. We call it in public health a horizontal approach, not just vertical with vaccination, but many other things, including strengthening the public healthcare system. And this will help us not just with COVID, but with other infectious disease, and in general, to have the system that is overwhelmed, treating also other issues. And this is the true public health approach, a comprehensive approach.